Well, joining us now via Skype from Geneva, Switzerland, to tell us more about these findings is Dr. Catherine Hankins, Chief Scientific Advisor for UNAIDS. Dr. Hankins, welcome to the program.
Nice to be with you.
Well, with a 90% reduction in transmission, can this finding kind of override other preventive measures already in effect?
Not at all, but I do think it does help give some peace of mind for discordant couples. The results apply directly to discordant couples, so couples who have been together a while in which one person is HIV positive. And we're advising couples to consider what their combination of prevention options is and to decide what they want to do. So, for example, if the woman is HIV positive, she can now come on treatment and the man can get circumcised and they have better coverage. If they're already using condoms correctly and consistently and it's incorporated into their sex lives, they should continue to do so, as well as looking at the options of early treatment and male circumcision. Hopefully we'll have tenofovir gel or another microbicide eventually too that women can use.
Now, this study obviously focused on discordant couple, as you say, but most of them were heterosexual couples. Would there be another study to look into homosexual couples?
I'm not aware that there will be, looking at the transmission parts of things, and we haven't seen the behavioral data to see how many heterosexual couples were practicing anal sex. But theoretically, one would likely see the same kind of effect, a reduction in the virus in the blood, followed by a reduction of the virus in the genital secretions.
Now, what does this new discovery treatment for prevention mean in terms of future prevention and treatment methods with regards to HIV/AIDS?
Well, you can imagine a situation, for example, where couples now come forward for testing and counseling before pregnancy or in early pregnancy, and if the man is found to be positive, normally he would be at risk of transmitting to the woman during pregnancy or while she's breastfeeding, which would be a very high risk to her, obviously, and to the infant. So now he could start on treatment. He could start on treatment and avoid that happening and protect his HIV negative wife through her pregnancy and breastfeeding. So we can see that as an option, an additional component that will be added to the programs to prevent mother-to-child transmission of HIV.
What about the use of condom in the couple in case they're not looking for a child? Would that be something that they might not consider anymore then?
Well, we don't know. Again, for peace of mind, one would want to combine several measures and not rely just on one. And secondly, when you do start treatment, it takes several months for your viral load to come down, and you really do need to have access to viral load testing, which is very expensive, in order to know that the virus has come down in your blood. So this has big implications for our treatment 2.0 strategy to try to get better diagnostics, viral load tests that people can use, and to bring down the cost and the adverse events associated with some of the treatments that are out there now.
Well, Dr. Hankins, thank you so much for joining us. That's all the time we have for today.
It's a pleasure.
Thank you. And that was Dr. Hankins giving us some very interesting information about this study, groundbreaking study indeed.
Always groundbreaking. Well, thanks for being on top of it, as always. That's Linord Moudou. She's always with us every Tuesday and Thursday, always has the latest health news right here on In Focus.